All right, so we're going to look at ophthalmia neonatorum. The notes I sent already in the group. So I can't remember very well whether we covered this in class, but there's no harm. We can go through now. Then we see how proceed after this. The last notes I checked with Simeon I sent was ophthalmia neonatorum and birth injuries. And I was saying these are the emergencies that we face when dealing with pediatric cases. So without wasting so much time, we say ophthalmia neonatorum, or simply known as neonatal conjunctivitis. This is infection and inflammation of the conjunctiva. So you can see already here the conjunctiva has changed color. That is pus. Conjunctiva should be colorless. It's a glass-ish membrane that covers the eye. You can see that, glittering color there is coming from the conjunctiva, but here, because of pus, it's greenish and yellowish. So those are objectives you can check on later on. So like we're saying, this is an infectious condition that affects neonates or infants, if you like, but commonly seen in neonates, newborn babies, caused by either bacterial infection, can be caused by fungal infection, or sometimes viral infection, leading to some discharge. So one of the characteristics of conjunctivitis is inflammation itself. There's inflammation of the conjunctiva. So there will be increased blood flow to the conjunctiva. Therefore, you see the eyes changing color to red. That is in the acute phases. So there will be red eyes, there will be discharge, there will be painful, itchy eyes or painful eyes. And then in the later stages, that's when you see discharge. The baby also have photophobia, all right? So you need to manage these babies in an environment where light is low to prevent further irritation to the eyes. So it's seen usually within the first month of life. Causative agent, mainly microorganisms that causes contamination of the conjunctiva. Now, this is a newborn baby. So where are they getting the infection from? So this infection is acquired during birth or slightly after birth. So during birth, you may suspect that this infection has been transmitted from the mother to the baby. So a mother who has an STI, a mother who has a UTI, will actually transmit that infection to the baby during labor. And that's why you want to manage all those problems antenatally. STIs, UTIs, treated before the baby is born. So in no order, we have chlamydia trachomatis. This is a bacterial infection. Now, chlamydia behaves, when you're studying chlamydia, it may seem as if it's a virus, but actually it's a bacterial microorganisms. So this is a leading cause of ophthalmia neonatorum. So acquires this infection from the mother as a urinary tract infection, or it could be a sexually transmitted infection. Now, this can lead to blindness because of the nature of the bacterial infection itself. Remember, it's behaving like a bacteria because most of the bacteria, they can grow outside living cells. But when it comes to chlamydia, chlamydia wants to grow and multiply inside a living cell. So because of that, it causes damage to cells, scar tissue forms, and then that can lead to a blindness. So a membrane will start covering the eye. So that conjunctiva is inflamed. And remember that conjunctiva is a simple columnar epithelium. So those cells are damaged, and then scar tissue forms, and then later on blindness can result. Other causes, we have Staphylococcus aureus, pneumococcus, streptococcus, E. coli. E. coli is among the common cause as well because of the commonality of this bacterial infection. So this infection or microorganism can be passed from the nurses who are managing the baby. So poor hand washing, poor aseptic techniques, and then baby's eyes become contaminated, or indeed the mother herself because of poor hygiene. E. coli is part of our normal flora from the digestive tract. So after using the toilet, using a tissue, chances are the hands are contaminated with E. coli. Therefore, we need to wash the hands before handling our patients. And because of that, finally, babies become infected if there's poor hand washing. And then we have Pseudomonas aeruginosa, which causes severe ophthalmia neonatorum that can lead to blindness. Same with gonorrhea, a sexually transmitted infection that can be passed from the baby to the mother. So we see that bacteria leads, but even viral infection can cause ophthalmia neonatorum. You see this in patients who have measles. Babies with measles, eyes become reddish, and if not taken care of, there will be now super infection. Starts as a bacterial infection, starts as viral infection, measles virus causes ulceration in the cornea as well as the conjunctiva. Then bacteria takes advantage. That's when you see pus. So it's on its own. Measles will not cause pus because that's a viral infection. But now when bacteria takes advantage, that's when you see pus. So it can cause to other complications and can lead to blindness as well. That's why you have to do proper eye care in patients who have measles, especially babies, so that they don't develop complications, eye ulcers that may lead to scar tissue formation and later on blindness. So I just wanted to give a brief information, more information about chlamydia, saying this is an obligate intracellular bacteria, which is not common among bacteria. This is common among viruses. It's a rod-shaped bacteria, like you can see here. It's aerobic, therefore wants to be in places where there's a lot of, or multiplies in environment that have high supply of oxygen. It's a gram-negative and very difficult to stain non-motor and infects columnar epithelial cells. Like I was saying, the conjunctiva is made up of simple columnar epithelium. Now, before we go any further, I want to remind you that conjunctiva is of two types. There's conjunctiva that covers the actual eye, so that globe, the bulb of the eye itself, we call it the bulb. That then there's conjunctiva that lines inside the eyebrow, the eyelid. Sorry, this is the lower eyelid. That is the upper eyelid. So inside the eyelid there's conjunctiva. So it's named. There are two types of conjunctiva. The conjunctiva that covers the eye itself is called bulbar conjunctiva. Then there's conjunctiva that covers the inner surface of the eyelid. It's called palpebral conjunctiva. The eyelids are called palpebral. So there's palpebral conjunctiva as well as bulbar conjunctiva. So in this case, the child will have both bulbar conjunctivitis as well as palpebral conjunctivitis. In adults, you may have just one, maybe inflammation of the bulbar conjunctiva only, or just inflammation of the palpebral conjunctiva inside there. But in babies, they have both palpebral and bulbar conjunctivitis. Then you see pus accumulating like we have seen in that diagram. So that's the cause. Again, those are more characteristics of chlamydia. Mode of infection. How does the baby become infected? I think I was hinting on this. Number one is intrauterine infection. Mother was an STI, mother was a UTI, and they're not properly treated or not even identified. This is a woman who has not gone for antenatal clinic. And that's why we emphasize that all pregnant women must be enrolled into antenatal care. During the process of labor, this is straightforward. The baby will pass through the birth canal, and if there's infection sexually, or indeed infection in the urinary tract, especially urethral infection in females who is pregnant and about to deliver, chances are that they infect the baby. That's why chlamydia is common. Then infection after labor, I was explaining, that infection can come from the mother, poor hygiene, or from the health worker, again, poor hand washing and the poor septic techniques. That's when the baby is born. Quickly wipe their face, eyes, and then treat them with a tetracycline eye ointment. I don't know the protocol now. You are the guys in the hospital, but previously it was mandatory that all babies born must be given prophylaxis, anti-prophylaxis with the tetracycline eye ointment. I don't know currently. You can advise me, those who are working from the labor ward, if at all you are located there. So that was a way of preventing eye infection so that babies do not become blind later on. You have to pardon my voice. I have a cough. It's clearing at least now. I can speak properly. So pathophysiology, we can just look at most important steps. This is infection of the eye. So where do we start from? We're starting with contamination. All right. So I would like you, when you're explaining now, let's say this comes in your end of year or maybe even your licensure, you must first of all describe the conjunctiva. All right. Conjunctiva, this is epithelial tissue that covers the eye as well as the inner lining of the eyelid. It is a simple columnar epithelium and is transparent. Okay. And when the eyes are contaminated now with those agents that we talked about, E. coli, chlamydia, pseudomonas, what follows next? The immune response. So following infection, the immune system is activated. What happens? Blood vessels dilate. So there will be increased blood flow to the eye. Now, the conjunctiva, since it's epithelium doesn't have blood vessels. So blood vessels are dilating to supply more blood to the epithelial tissue. That's why the eyes become red. Yeah. So when the blood vessels dilate now, that's when you see immune cells migrating from the blood vessels into the affected tissue, which is the actual simple columnar epithelium. So you see surrounding the papilla and so on. Yeah. So papilla, we're talking about the tissues that suspend the lens. So eyes become inflamed, meaning the immune system is reacting now. Blood vessels are dilating. Now, as the cells are crossing from the blood vessels into the affected tissue, it's not just the cells, fluid also, plasma, together with some plasma proteins, also shift from the blood vessels into the tissue. That's why the eyes swell. So the baby wakes up with swollen eyes. Now that creates a problem because where the cells are going, the white blood cells, together with plasma proteins and the plasma itself, the fluid, they're going to cause pus formation. So the cells are acting on that. Bacteria is dying, and then that's when now you see pus. So that's where the pus comes from. That's why a child wakes up in the morning and fails to open the eye because that pus becomes thick and sticky. So the child can't open their eyes. And that's when you see now those signs of conjunctivitis. Red eyes because of increased blood flow, because of dilatation of the blood vessels in the cornea. So corneal blood vessels dilate because the cornea is a connective tissue. So instead of becoming white, it's now becoming red. Pus formation because of the dead products and the activity of immune cells, mainly phagocytes. So pus is because of the plasma, plasma proteins, plus dead cells and microorganisms. Then you see other signs: swollen eyes, painful eyes, photosensitivity. So already we've talked about the clinical features. Number one, swollen and sticky eyelids. I take you back to that. Look at that. There's congestion there. Blood vessels have dilated. Fluid is shifting from the blood vessels into the nearby tissue. That's why they are swollen. And then because of the pus that is forming, the eyelids are stuck to each other. Wake up in the morning, you find the baby like that. When the mother is bringing the baby, actually, they've wiped out the eyes. They've wiped up the pus. So eyes can be clear, but you see the eyes are red, the cornea. Cornea will be red. And then just some few minutes later, you see pus forming again. So it's continuous during the day. But it's highest in the morning when the baby is waking up. During the day, you see a bit of pus. Depending on the infecting agent, the color of pus changes. Can be greenish, whitish, yellowish. So those are the signs. So congested swollen conjunctiva, thick and purulent discharge, which is pus, excessive tearing, which is a protective mechanism. Tears are always flowing, but in this case, there's excessive tearing or lacrimation. So the tear glands, they produce more tears to flush out the microorganisms. Then swollen eyelids that are stuck to each other. I think this is a repetition. Thick. Yeah, this one. Sticky eyelids. It's the same here. That's a repetition. Next, you look at photosensitivity. So this baby, you shouldn't expose them to uh, bright lights. You need to be managing them in low lights or dim lights. Yeah, apart from that, this baby will be irritable and restless. So be crying and they're not easy to console. Yeah. Then red eyes. So in the acute phases, you see the eyes are red. So the conjunctiva, cornea is red. Pus may not be there or could be there in the early stages. So that's the baby there. Eyelids, edema around the eyes, periorbital edema. Then there'll be some discharge and the redness around the cheeks there. Yeah. Investigations, how do you go about trying to diagnose this condition? So just from history and physical exam, you should be able to diagnose and begin empirical treatment with antibiotics while you're waiting for the sensitivity to see exactly what type of microorganism is causing this problem. So history, of course, you get from the mother, they'll tell you this child is, having red eyes, and now there's pus every time in the morning. We have a bit of, some mucus, but that is not pus. In the morning when you wake up, you find some mucus in your eyes because of the columnar cells. The columnar cells, they have some bit of goblet cells that produce some mucus. Tears have mucus in them. So at night, in the morning, we have mucus, but that is not pus. So when this condition is there, you see pus. Yeah. Next, so I was saying red eyes first, then mother can complain about pus. Then next is swollen eyes. Baby is having swollen eyes. And every now and then they have to wash their eyes to remove the pus. Uh, then there could be history of fever, baby having fever, maybe even refusing to feed, and baby being irritable, very difficult to console. Physical exam now is you to do and inspect, you visualize and see what is affecting the baby. So at the time that the baby is brought to you, you may not find pus because maybe the mother has cleaned the eyes, but you see that the eyes are swollen. You see that the conjunctiva and the cornea is red. So there's red eyes, swollen eyes. Then if you're lucky, you find eyes eyelids that are sticky and closed because of the pus itself. But it's rare because most mothers, clean the babies' faces when they're bringing them to your facility. Yeah. So that's under physical exam. Red eyes, swollen eyes, baby that is crying often. Mhm. Then you diagnose this baby has neonatal conjunctivitis. Other investigations now to confirm your diagnosis, you need an eye swab for culture microscopy and sensitivity. Culture to grow the bacteria, microscopy to identify. We're saying chlamydia is rod-shaped and so on and so forth. Then sensitivity against particular microorganisms, particular antibiotic. Then other non-specific investigations that you can do, you can now do the full blood count, which shows elevation in white blood cell count. Otherwise, do not wait for eye swab results. History, physical exam, tentative diagnosis, ophthalmia neonatorum, and begin treatment with antibiotics. So the following antibiotics are used: penicillins, broad spectrum. Chloramphenicol more aggressive and covers both gram-negative and gram-positive bacteria. So even before you have results with this chlamydia, whether it is E. coli, chloramphenicol eye ointment is very effective. Same with the tetracyclines. Now, yeah, one of the tetracyclines is tetracycline itself. Then you have aminoglycosides such as gentamicin. So these are all antibiotic therapy that can be used. So one of these plus any oral treatment. So you're doing eye ointment for local infection. Now there's chance that some of the bacterial products may find themselves into the blood vessels. Remember, there's vasodilatation, so that can become a systemic infection. Baby now develops sepsis, what we discussed already, neonatal sepsis. So that's why you're going to give now oral erythromycin. So before discharging the baby, make sure they also go with some systemic antibiotic. In case of gonococcal and chlamydia, you use systemic antibiotics such as gentamicin. This can be delivered via parenteral route injections. Yeah. Nursing management, how do you manage this baby? You have given tetracycline ointment, or you have given chloramphenicol or gentamicin, plus oral aminoglycosides such as gentamicin. Now, nursing-wise, what do you do? First of all, this baby must be isolated to prevent an outbreak. Other babies may be infected because as you are managing this child and with poor aseptic techniques, you may actually contaminate other babies as well. So they must be isolated. Next is offer psychological support to the mother and then quickly do eye care. So now eye care precedes topical application of antibiotics. So before you give antibiotics in the eye, you must clean it. But parenteral one can be given. Parenteral oral, if the baby is able to get orally, you give. If not, then injection. But before giving in the eye, instilling there the eye droplets or the paste itself that is applied there, eye care should be done. I don't know if, yeah, I have this diagram showing eye care. Now, yeah, I don't know if this other eye was infected, but it could be the child has both eyes infected or just one eye. Nevertheless, if a child has only one eye infected, both eyes should be treated. If both eyes are infected, well, then treat both of them. Now, you see that the baby is tilted to one side, and then the eye is flushed with normal saline first. So before flushing, you would have cleaned with a clean gauze. Clean gauze, then discard the swabs. Clean gauze, discard the swabs. When the pass is done now, irrigate the eye with normal saline. Until the eye is clean, that's when you should apply eye ointment antibiotics, which can be in form of droplets or the cream. The cream is even more effective because it stays there for a longer period of time than droplets. Because as the baby is crying, the droplets, the medicine is leaving the eye. So once the eye is clean like that, you can see it's still red, infection is still there. That's when this child you'll be able to apply. So each eye should be cleaned separate. Clean like that. Turn the baby on the other side and clean. Now, this is not a neonate. It was just for a pictorial, for audio visual for us to understand. You can see eyes all in there. So this one cleaned, turned on the other side, and then clean. So you see that the flushing is starting from the inner canthus to the outer, there, where the two up eyelids meet. The upper eyelid, lower eyelid is called the canthus. That's where you flush from. Then water collected in the receiver. Yeah. Same will be done for the other eye. So this water that is pouring here should not find its way on the other eye. And the same applies when you're cleaning the other eye. Once both eyes are cleaned, that's when you apply now the eye cream or ointment. So this should be done 3 times in a day: morning, midday, and evening before going to sleep. Yeah, so that the baby sleeps with the medication in the eye. Yeah. Now, when applying I don't know if I have a picture. Yeah. When applying this one is a droplet, but the cream should be applied like that. Pull the eyelid, the lower eyelid, and then put the cream in the palpebral conjunctiva there. That is a palpebral conjunctiva. That is a bulbar conjunctiva. The shiny part. This is the cornea to be red because blood vessels there will dilate and the color changes to red. Not that there's bleeding. No, there's no bleeding. So that's where you put the medication and then let the baby close the eyes. The medication stays there for quite some time. So 3 times in a day. Again, when applying, starting from the inner canthus to the outer. So you move it in that direction and then leave the medication there 3 times a day. Teach the mother how to do this because this child will not be admitted. They will be discharged. Complications. Cornea ulceration. Now, cornea ulceration, we're talking about this part. The conjunctiva will be damaged by the bacteria or the virus, and then there will be ulceration to the cornea. Now, that's a connective tissue, and that's where scar tissue begins to form. Eventually, it will cover the pupil and the iris. That's the iris, that's the pupil. Then be difficult for this person to see. And I don't know if surgery can be done to go and remove that scar. Blindness sets in. So that's one of the leading causes of blindness. So corneal ulceration followed by corneal haziness and then later on blindness. Yeah, those are the main problems that the baby will face as complications. So in addition to this, you can now do other general care for this baby. Remember what we talked about all newborn babies during prematurity. We're saying number 1, warm chain. All babies, newborn babies, make sure they are kept warm. Number 2, nutrition. Are they feeding? Are they getting adequate nutrition? We're saying at least 8 feeds in a day. Breastfeeding, by the way. Yeah. Infection prevention. Apart from eye care, applying ointment, and so on, we saw that there was also addition of systemic antibiotics. In addition to that, the cord is still cut at this point. So we must do cord care. Just like we explained during neonatal tetanus. Cool boiled water, and then you do breastfeeding exclusively for 6 months. And then after they can use